say that on.
Good morning, welcome to House Healthcare. It's Thursday, February 22nd. And we have budget mostly on the agenda with a break to do peer support, I believe, amendment at some point. So Claire will let us know when that's time. So we all have in front of us a spreadsheet. Is this on the committee page? Okay, so it's on the committee page as well. I just want to be clear. Public, this is a spreadsheet our committee put together, specifically Daisy and Melanie, based on what we've heard in this room about budget. So if there are people see errors, you can feel free to text me. Okay, so I think what we'll do is just start from the top and do a quick, not quick, but talk about each one. We might remind us what they are. If there's any clarifying questions, or we can have a little conversation. Not looking to do any discussion about whether or not we fund it at this point. Okay. So Daisy and Melanie, is there a way you two want to split this up? I'm putting you on the spot.
I think we'll just kind of tag team it as we go through. But kind of like last session, we divided this up into rows and columns. The one times, things that are in the base by agency and department. And then we have just one language change. It was for Green Mountain Care Board. The details in the far right column, those are mine and Melanie's notes that we'll highlight as we walk through. And then where we're going to spend most of our time is going to be down in the HHC proposals. And that's where you'll know a lot of the folks who came in and gave testimony on requests that are not reflected in the governor's recommended budget. So things like the Howard Center request, the FQHCs by state, Vermont Care Partners, et cetera. Those are all reflected there, and I'm guessing that's where you'll want to spend the most time, Lori, and
Probably.
sort of reflecting on things. So to start at the top, so one last thing, the columns, we reflected as we did last year, the financial requests are as gross funds, and then the amount of state or general fund requests. So anything that has a global commitment or a Medicaid component, we didn't break that out separately. We've realized that most of us really just care how much general fund you want. And then there's the lump sum or total, which includes federal and state funds, and that's the gross stuff.
And a big shout out to Nolan. Thank you for helping. I'm not here. Can you help us? And if there's ever one, is like, can we drill down further? He's got the data on that, and we have that. It's not tagged on your sheet, but we have it on the live spreadsheet. He really helped us to tease out those numbers to the best of our abilities. They may not match what's in your other documents because we did some math around like the matches sometimes. So like had to check some things. So if there's a discrepancy there, we can ask him.
There he is.
There he is.
There he is. We're just talking about you.
Yeah.
How great you are. Okay, so is everyone good with the layout of the spreadsheet? Any questions on that?
I had one question, and I'm sure it's easily answered. The first piece is one time, and under the base funding, there's one time designations there. What's the difference there, Daisy?
So it's a one-time request, but it's for a facility that is,
It's not just that one specifically, there's several others throughout. And I just wanted to try to.
So you have these two listed as one time, right, up at the top.
Right.
So why are they separated from? So the rest is just whether it's base or one time, but those two are specifically separated. Was there a reason for that?
maybe we can start going through, but those are one times in the governor's recommend.
Okay.
Does that make sense? So
I
they're
guess so, yeah.
in the section, if you look over here in the sections, they are. the B1100s. So if you look at the governor's
Okay,
recommended
these are in the
budget-
governor's recommend.
Yes.
He's thought to,
Okay,
and the rest are not.
that's right.
Okay. That's easily.
Well, that's not necessarily the case. I think we're gonna get to
Yeah,
your.
no big deal. I
Yeah.
just, no big deal at all.
It has a section number, it's in the governor's right.
Gotcha.
And there's more than those, just those two, one. And we can fill and change as we go along.
Yep.
Okay.
Okay, so starting with a one-time request, and this goes to, it's a request that is for a youth psychiatric inpatient treatment facility. And this is $1 million from the general fund. And this is related to the same facility that we funded the fit-up costs for in the BAA. This is in the governor's recommend.
Yep.
Not to be confused with B307, which is a 15-bed facility that's being run through an RFP, was through DCF because it's also a youth residential treatment facility. And that we'll address in a couple rows.
So the first one, if everyone remembers, is a VMC. From last year, we put 9.2 million in the budget for them to open, I think it's 12 beds.
Yeah, it was 9 to 12. and
9 to 12 beds.
settled on 12.
For co-occurring youth who are having medical and mental health concerns, issues. And so we don't really have a place for those youth. So this is, and I just sent, and I apologize, Daisy, because I just got this and sent it to everyone and have asked Claire to post it. So we got a little bit more information on this and we'll come back to that. But that's just make sure we're all grounded. And this is the SVMC.
Where is that facility?
Bennington.
This is the Bennington one, all right.
The other one's Brattleboro, which is
Okay. The second one is, a one-time request to cover the general fund portion of global commitment, for Diva's Medicaid global payments. Now, this is, we're gonna ask a question, Leslie?
Oh, go, I was looking at your net.
Well, yeah, so I'm gonna let Daisy and Melanie kind of run this.
Okay,
off
so
on
if
it,
we have a
so-
question, check in with you. Okay.
Over in the notes, I've noted that this is really related to the AHEAD model. So what they're doing is a pilot to kind of, in essence, test what would the scenario look like if we moved to the AHEAD model and had a prospective payment system. So this is to fund sort of this gap where were we to onboard providers to that payment environment where they were paid a per member per month rate versus fee for service. So this would just cover that model year. And it gives us more information so that if we do pursue the AHEAD model, we go into it with clear eyes of what the financial risk of that might look like. Again, it's a one-time request. The general fund impact is 6.9 million.
So I have a question. In the AHS budget in the central office, they added 10 positions. And I was wondering where those positions were, was that for this or something?
That is not in the positions. So can we maybe go through it and then address that would be
Sure.
my suggestion.
Whatever works for you. I was just curious about that.
But that's not in here. In general, we didn't add in any of the salaries and operational stuff into this. This is largely programmatic things that we addressed.
Great.
So maybe at the end, I'd look to Lori to kind of discuss what we want to do with operational and workforce changes. Okay. Are there any questions about that ahead? I mean, so maybe Melanie, what do you think? Just kind of quickly go through the base requests.
And then like, to Art's question, I'm not sure what the base one time, because I know that these are some of the things that Lori was filling in, so I don't know if we didn't.
Okay,
So if you, can you?
I can
talk about
jump
it? That'd be great.
absolutely, it's a group effort. You want me to start?
So I. Sure.
Okay. So Vermont Nursing Forgivable Loan Incentive. This is the program that we've had continuously. VDH does this. And so this is just base funding for the program, right?
Yep.
Okay. You guys want to do it or?
Yeah. And then there's that psychiatric treatment facility. This is the 15-bed facility. We have not taken testimony on this. Again, that's because the RFP went through DCF. I think that's the only thing that kind of popped out to me when I saw this in Diva's budget.
Yeah. And so I will say to that, again, what we just got from DMH is some more information on this, which has been sent to you all. Claire's posting it, so we'll come back to that when we do this one and read through it together.
Great.
Is this the facility in Berlin? This is in Brattleboro.
This is where we have youth out of state, mostly in Florida. And we're looking to bring those youth back by using the Linden Hall or whatever it's called at Brattleboro Retreat.
Is this where they have mental and physical problems?
No, that is the Bennington one. That's a very, yeah.
Okay, right.
And now there,
Could I ask a question? I'm
Yeah,
just
probably.
curious if I may, why did you choose these to pick out as opposed, like, what was the thinking behind these?
all of these DMH, these are all DMH, these are all things that we took testimony on from DMH.
Okay,
So these were all in their request to us.
okay,
That the commissioner came in and testified on. So these, they're not necessarily, I mean, I don't think, and this is where I would look to
Yep.
Lori, they're not necessarily things that,
They're
Last
things
session.
they're policy decisions that we can make decisions on. When some things like staffing and pay raises and contracts, I mean, we can talk about that, but these are specific policy initiatives that this committee should make decisions on.
so that we do have the access to them and say, no, we don't think we want to fund it. I'm not, I have no
that's
opinion,
fine.
I'm not expressing opinion, I'm saying, but here because we might choose not to.
Yes, these are all policy decisions for our committee, most of them.
yeah, there are the two that, in the HHC position column. Melanie and I noted there are two that one is contractually required. And that's B314, the psychiatrist contract with Columbus for Vermont Psychiatric Care Hospital. And that's just a request to reflect the increasing costs of psychiatrists. I thought it was important to note it though, because it is such an impact on our system of care, the cost for psychiatrists, and such an impact on our workforce as well.
If I can just add, so this is the one where UVM Health Network or UVMMC was doing the psychiatrist rate at VPQH, I'm sorry, VPCH, and then they declined not to renew the contract. And so as Stacy said, this is a new contract and increased costs.
We're in the contract, so.
Yes.
that's one.
And we can't have facilities without them.
No, we
Can't, yes, without them, right, sort of given.
The other one that's mandated is related to the competency to stand trial and insanity as a defense. So that is actually legislatively mandated in S3. I forget which act that turned into. So this is also, something that we have to fund. But the other ones, like Lori said, are, they're policy initiatives and so they're there for awareness. The other one I would highlight is the last row related to 988. You'll remember DMH testified on this and they are asking for a little under 200,000 from the general fund to for 988 sustainability and implementation, because some of their federal grants are winding down, although they do have a couple more grants, remember, that bring up the total funding for 988 to the state to a little more than 1 million across all their grants. And that total isn't reflected in the gross column here because those grants simply hadn't come in at the time that we had them.
Will that impact the general fund?
No, I don't think so. I think those were federal grants that hadn't yet landed.
Gotcha.
Again, I highlighted, at the page 2, row 1, a rule. This is, I guess it's almost required because there is a rule that states that the highest paid staff can exceed 7 times the living wage. So that rule's kind of limiting the programs with a psychologist or psychiatrist. So we need a little extra money to cover that. It's a PNMI increase for rule changes. There's another PNMI inflationary increase. I think we have this request every year. And then finally, there is the embedded mental health workers. I'm not sure that's the appropriate term to use. This request that's actually in DPS budget, which we heard testimony yesterday morning from Morning Fox on, for 2.5 million. And that is the gross amount. I don't remember how much of that was general fund.
Did you say that there was no match to that?
There's no match.
There's no
So
match.
this is all general fund.
It's just in the wrong column. So we broke down, where the application of that lump sum is in the proposal column. And I highlighted in the notes that, the main question and reason that Melanie and I thought it was important to include this here is because it is so related to all of these above ones, which reflect our investments in a coordinated system of mental health care for Vermont.
May I add into that?
Please.
And if you look in the description of what the testimony, this number is for the full 20 positions, not just shoring up. There was 2 tiers we
Yeah,
talked
right.
about, the shore up and then the gold
This is for
standard.
20
It's
positions.
for 20 positions. And so we tried to tease out in the description so you could see the levels of what that funding might look like if we choose to say this level is where
There's
we.
no GF in this.
This is all general fund. This is all general fund. It's just in the wrong column.
Yeah.
That is in, okay, I missed
Yeah.
that. Okay,
So we'll come back to that in great detail.
right.
So what is current, like what was in fiscal year 24?
We can go back to other reports if we're going to come back and discuss this in detail.
Yeah, we'll come back, but I think it was about 585.
Okay.
Next is just the one language change that we wanted to note, and that was the Green Mountain Care Board's bill back language proposal, and that's net neutral. All the stakeholders agree, but we wanted to just highlight that some of the slight adjustments for their funding across the board from their stakeholders. And then we come to the areas that we want to focus a little bit more on, and that's some of the proposals that were not in the governor's recommend. And these, Lori, do you want to just go through in more detail as we go through rather
Yes.
than come back to them?
We can do that.
So first let's start with the Visiting Nurses Association, which would fall into Diva's budget. So their request is to, Lori, I'll need your help on this one
Yep.
because it involves the Lupa rates and maybe Nolan's help.
Yeah. And Jill Olson's in the room too, which is helpful.
So their request is to come to 100% of Medicare Lupa rates, and that would assume an expected update on January 1st, 2025.
Because remember, they're not on our fiscal calendar,
Right.
they're on a calendar year.
So they do a June and a January 1st. And then they also are working with DIVA to develop a methodology to compare home health Medicaid rates to Medicare home health PPS. And this is the part that I still struggle with. I'm sorry, Jill. But the request is from the general fund, 514,000. for a gross amount of 1.2 million.
So I'm gonna look to Jill. Do you want to come up for a minute? Do you mind? And just make sure we're going right, because I will say I get confused by it too.
Okay. Thank you for the opportunity. Good morning. I'm Jill Olson. I'm the Executive Director of the VNAs of Vermont. So, which part, so should I start with the dollars? Okay, so
just
timing.
dollars.
Yeah, so first of all, I think the number's a little low. I redid it when I did my budget testimony, and I would put 550 in there to be safer.
In the general fund.
Yeah, I think it's just safer. I need Diva to do this math, but I saw how I did it when I presented to you, and I realized it's probably wrong. So this is what happens when the lobbyist does the math. I always defer to Diva. But that's neither here nor there. So what we're saying is, so we would have, in a perfect world, we would have gotten an increase on January 1st in line with the LUPA update that happened on January 1st. So, and we've requested that in the BAA. That remains outstanding. We don't know what's going to happen with that. So what we're saying is that increase we had hoped for on January 1st, please give it to us on July 1st, since that's our next opportunity. But then again, on January, the LUPA rate will change again. And we are on that annual cycle. So if we're going to stay on that annual cycle, I think the base of our ask is, please bring us to 100% of LUPA and keep us there. It's like how I would put it in words, meaning on January 1, you would then update it again so that I won't be sitting in this chair during BAA next year, because the money will already be in the budget starting in January, is sort of what I'm trying to get at. We tried to do this last year too, and I think it got confusing last year too.
So we want to, so you're not at 100% right now.
No, we're at about 88 right now. You brought us to 90 last year. LUPA went up, so our rate against the LUPA is a lower percentage.
Say that again, sorry.
We're at about 88.
Mhm.
You brought us to 90 last year, but that was 90 of the 23 LUPA.
Mhm.
Because it went up, we're at about 88 of the 24 LUPA. Every time we don't get an increase, we lose ground against the new LUPA rate, assuming it goes up, which it normally does.
And that's a federal change.
Federal change, yeah.
Everyone-
That's about, so it goes up, I'm guessing 3%, which I think is high. It's normally gone up by more like 2, but they've done a little bit higher in recent years. So it's a pretty nominal amount. Most of that 550, about 500 of it is the bump to 100%. And then the rest is the bump in January. It's going to be a pretty nominal amount once you get us to the 100. On the language, the reason we're asking for it to be compared to Medicare PPS is because LUPA is just part of our full Medicare payment model. And it's a low part of our payment model. So at 100, we think if you get us to 100% of LUPA, you've probably gotten us actually to about 75 of full Medicare. And so rather than having to say that every year, I think it's time that we understand and come to agreement with Diva about where we are against our full Medicare payment model, which they don't use, which is why it's not clear.
So the language isn't in here, but Jen has language, and Jen will be in this afternoon that we can talk about language.
We dropped a little, it's not in the upper, it's in the very last column in the last page of the spreadsheet. We just dropped things there from Jen and other people, so
Okay.
you might just to go back to it.
Okay.
Yeah.
Great. All right.
Question.
You may ask a question.
And just to clarify, so
And
you're
you
asking,
are,
for the record, Noel Manlow, for the town office. And so just to clarify for the room, you're asking for a start of January 1 at 100%.
No, I'm asking for a start on July 1 of 100% of this year's LUPA and an update on January 1 to keep us at the new 100%.
And your 550 is assuming that bump.
Yeah, because the bump is small. I think it's about 500 to get us to 100% of the current LUPA for July 1. And I think it's enough. It's like 30 to 50 to keep us there on January 1. I think it's possible I'm doing the math wrong, but I kind of looked at how I did it, Nolan, was I looked at the spreadsheet Diva created, and I looked at what it would take to get us from 88 to 90, because that's on the spreadsheet, which is about a 2% increase. So I just kind of guessed based on that. I think it was a reasonable guess, but I'm not, as we know, I'm not this spreadsheet person. But no, the request is for July 1 with an update on January 1. I know it's really confusing. I worry about asking for it because it's confusing, but I also am really sensitive about how people don't want us coming back in the BAA to make these requests. So I'm trying to fix that.
And that was my question.
Okay.
Will this amount prevent you from having to come back?
Yes,
You're
yes,
right. Yeah,
yes.
okay.
That's what I'm asking
That's all.
for, is an
That's
amount
what-
that will get us the, right,
Good.
because we don't want to wait until January. If we waited till January for this, we would wait a whole year between increases. Our last increase was in last year's BAA. So that's why we don't want to wait till January. Yeah. But it would be half that amount if we were looking for January. I think this is the annualized amount. You have a thought. Okay, thank you. Thank you for the opportunity. I appreciate it. Okay. Let's keep going.
Okay. So let me switch my what I can see. Vermont Medical Society, they are, and I just got an email from Jessa, there's a language change adjustment that I will add to this spreadsheet. But they're, yeah, I need to update this request. Melanie, do you have the fiscal request?
Did we get numbers on this one?
Yeah, I'm gonna skip this one. for
Okay.
now. Come back to it.
We know what VMS is, so when we have the numbers, we can talk about it.
I believe I was gonna be sending them and I haven't.
Health Equity Advisory Commission, they have recommended that the Office of Health Equity be placed in EDH. And so they need 250,000 for operating and staffing. And then the Health Equity Advisory Commission, commission, needs 450,000 for their operations, community engagement, and consulting. And that we have in the gross column, although it says no match, so I think, oh no, that is, that is in
Yeah.
general fund. So that is all general fund.
Is this in the governor's recommendation?
No,
No, none of these are in the governor's recommend. Now, there was some questions about whether or not this group got the money that was in the fiscal year 24 budget. There's money in the budget in fiscal year 24, but they had to meet certain criteria. And I don't know if you remember, they came in, they're like, we met the criteria, but there's some confusion of where the money is. So Nolan, can you update us on that?
What are you talking about?
I will say, Health Equity Commission,
Oh,
in the money that from fiscal year 24.
my understanding is that the money is there. It just left, the ship left the port. The ship left for sea but never arrived at port. And so it's an administrative piece where they haven't connected place for the money to land. So they're aware of it and they're working on it.
Who's they?
The administration. So the money was supposed to go from one place and then move to the other place and, from, I forget, from whoever it was, AOA over to like DMH or whatever, and they didn't do the language to connect it on the other end and get some confusion. So I think what you might do is just remind them to make that connection.
Does this happen with other initiatives? Is this common? That money just kind of mysteriously disappears in transit and doesn't get?
I don't think it's a money disappearing as much as an administrative mistake on rebuilding the budget. That's it should be easily correctable if they're on the same page.
How much money was there for that?
250.
250, oh, that's what the 250 is?
Or the forfeit, I don't remember.
There's two parts, there's 250 and then a 500. And one was for the office and one was.
So my understanding is the administration's aware of it and they're trying to remedy it. It wasn't an intent to cut.
So that money hasn't been spent yet for this year?
It was an administrative error.
Yeah, right. No, I just.
And the email that you sent to us, it's from someone, I don't know who it was, but it said that it was baked into the admin budget for FY 25. So it's in there, it's just.
I think this goes to my next question, which is is the money that we're talking about right now all needed if there's another chunk of it somewhere else that is floating around?
Right.
So we asked that question when they testified, and we said, so if we can't find this money and it's just gone, what do you need in order to do your work? And they said, this was the money that they needed. It's what we put here, because we put it as a placeholder until we found it. But then they also still had it as part of their equation. When we looked at their presentation, they had the money listed as part of their budget if they found it, and this would still be asked. So this is something that we may want to like find more out, more information about, because it was a little unclear was when they were speaking about it.
Isn't that kind of appropriations job in the end anyway? Like, we just need to say what the policy priority is.
Yes and no, because if we're gonna fund it, we should have a good idea of the money.
So there's this slide, and I can share it. It has the cost and the budget, and it has the appropriated funds that we're talking about here. And this is all still needed, what we put here based on their presentation.
Yes.
So this is the best ask. We have the money that we were going to get, and this is what we need to continue to work, and that's what's represented here. So whether that's, they're just, that's.
So that's above and beyond what the ask was before.
It's above and beyond what they got in the
Yeah,
24
That's
budget.
right.
Yes.
Okay.
But it's because it's creating a new office
It's
of health
creating a new
equity,
office of
which
health
it was the legislative intent of the original bill and still hasn't happened.
Right. Right. So it's
So, just so I'm clear,
Based on-
this request is assuming that money arrives at the port.
yes, correct. Yes.
Okay.
Yes.
Okay, yeah, then that's what I was trying to figure out too.
Yes. And that chart is.
Some of the boxes might be missing, but.
Right. Yeah. It might be over.
There's no pirates.
But Melanie did bring up the presentation from before, and so it's the cost, what was appropriated previously, and so then what's needed for fiscal year 25. Although I will say on the fiscal year 25 column, it's 200,000 for the Office of Health Equity, and then 250,000 for HEAC for a total of 450.
Okay, okay.
They,
You said that.
yeah, so,
So we might have found an extra $200,000.
well, we didn't have the money to begin with, so.
So this thing is not even operating.
Yes, they are.
Commission is.
The commission is, and the commission is responsible.
How are they being paid?
We put some money in when we originally passed the bill. And then we put money in the budget last year, which we're trying to get to them because they completed what they were supposed to complete and they made the recommendation. We gave a report and they're gonna put it in the office in the Vermont Department of Health. And then this is to continue that process of standing.
Could you summarize the ask with all this?
200,000 for the Office of Health Equity and 250,000 for the Health Equity.
Not 450, it's 250.
Advisory.
Okay, so make that 250.
So it's 450 total. It's confusing. They missed a total line on their presentation. Okay.
Vermont Care Partners. So remember last year we gave a 4% increase to the DAs and SSAs, which was the same amount we gave to FQHCs. For this year, there was a request for a 6.5% Medicaid rate increase. And that amount in this sheet is reflected. I think Vermont Care Partners is Amy in the room. Can we ask Amy to come up?
Sure.
Um,
If Amy wants to come up.
Do it. For the record, Amy Johnson, Vermont Care Partners.
Thanks for coming back.
No problem.
I just wanted to make sure that I'm correct in how I reflected your ask, because I know that when you came in, you had slides that reflected the DA, SSA, but then also long-term care.
Yes.
So I just want to be sure and give you an opportunity to clarify what just the DMH portion of that would be.
Right. So what you have here, the gross, the 34 million, that's for everything. So that's the gross for everything that we do. That's to keep the lights on. the subsequent information that I gave to the committee on the breakdown, the DMH portion, you'll see that as the 7.1 million as the general fund amount that we're requesting. That's accurate. So that looks correct to me. That's my math also and our CFO's math. So I would defer also to Diva to check my math, but that is the amount that we're requesting through DMH dollars.
Okay, so is there any general fund in that portion of the gross? I mean, any long-term care?
No, so the elder care that we had talked about is Dale dollars.
Okay,
Yep, so that's sitting with House Human Services.
and that 34 million is all,
That's everything. No, 34 million gross is everything. That's the entire DASSA ask. That's what we need to keep the lights on.
7.1 is the ask, the gross ask.
7.15 is the general fund ask DMH dollars.
That's the general fund ask.
Yes, general fund ask.
And 34 is your total, what you get currently?
It's the total gross amount that we need.
Okay.
I have a slide of, yes,
Here and
And- yes.
and human services.
for everything.
So that's why the matching dollars probably aren't matching up.
Yeah, it would, when I looked at that, I thought that's for everything. So that's why you're seeing such a big leap between the gross and the general fund amount for DMH. But the gross that you see there is everything that we need to keep the lights on. That was our 6.5% total request.
Art?
So the 7.15 million includes the state portion of the 6.5% Medicaid increase.
So the 7.5 is the general fund amount that we need.
Yes.
Right, but it
Yes.
includes that piece. Now, 6.5%, what does that put the rate at for reimbursement or increase? What does that do for you?
So the 6.5, during our presentation, the CFOs came together and landed on that amount based on increases to staff, operational costs, inflation. So it was 5 factors that they based that amount off of that you have in, I don't have it memorized or open on my
No,
computer.
no,
but-
I meant more, and I might be way off base, but I'm trying to,
I don't think it equate to what you're trying to equate.
okay.
Like
okay.
normally we say like 100% of Medicare.
Yes,
That doesn't work that way for the DAs and Fs.
okay, it doesn't work that way.
No, because
Okay,
it's a bundled payment
Okay.
that they get.
I got you.
Yeah.
All right, that's what I was trying to do, was
Yeah.
make sure they're up there where they need to be. for
Yeah.
the services.
And I'm looking for an email I have to send to everyone that shows, and Amy, if you have it handy and can send it to us, what the general fund amount would be for every 1% increase
Yes.
that we might do.
Yes, I don't have it up, but I can send it when I sit back
Okay,
down.
that would be great.
Because watching me try and do that right now will be painful for everyone.
Okay, it's fair. Did you have any more questions for?
no, I think that's it. I think it might be good to, in addition to sending the 1% increase translation email, maybe to have an apples and apples number, maybe, I don't know if Lynn can help coordinate that with the gross amount, having that.
Just for
34 million.
damage.
Yeah, so we're just looking at the portion that we actually make decisions on.
All right, we can come back to that then.
Thank you.
Thanks, Amy.
Melanie, you really are the expert on the next one.
The next two, really.
Yeah, the next two,
So,
which are those transportation.
oh, yes,
ones.
yes, sir. And Jamie's here, so if I get any of the numbers wrong, please hop in. My understanding is that the numbers that we see, there's 2 columns for the non-emergency medical transportation for Medicaid. The first one is shoring up the shortfall for FY 24. This is something that, these are entitlement programs. We have to provide these services. And so this money that is in the 1.2 million is to get us fiscally sound in FY 24. And there was some discussion about that there were some rates that Diva was working on to make sure we pulled down as much federal money. And this number reflects that work being done, but this is still needed to be to actualize what's being done this year. And then looking ahead for the budget for FY 25, there's an additional 1.6 to continue to be responsible fiscally for what is being asked to be done. In addition to that, when we met with Viva yesterday, they are committed to looking at the methodology for rates, because part of the issue with this is that the rates don't match the services that are being provided. And so Viva asked us to put languaging in for this coming session to look at how can they change the rates so that it reflects more responsibly to what is being done on the ground and what is needed. That is what the two asks are, and along with the languaging that we're going to give them.
Transportation.
This is the transportation.
Okay, yeah.
It required transportation.
I'm confused why there's no federal, why it's all general fund.
My understanding is that this was the number after the jump. This was my understanding. To get up.
Go ahead, Jamie.
Why
You-
is all of this
Jamie, you
in
come sit
general
down.
fund money, not, there's
Jamie's
no
gonna
match?
help us.
Because it's all.
Jimmy King on behalf of the Vermont Public Transportation Association. The numbers we presented are gross numbers, inclusive of federal and state.
So the 1.2 is gross.
Correct.
Okay.
Oh, okay.
Is that all with the state?
It's good to hear.
55-45?
That's easy to find.
Yeah.
All right, so
So it's
Nolan will
not-
get us that,
It's just in the wrong column.
just in
right?
one column, yep.
Okay, thanks.
And then the base funding of 1.6 is also gross?
Correct.
Okay,
Can't be
So-
500.
so 506,000 on the one time. And then Nolan, can you get us the amount for the base funding for going forward?
One, 6, 2, 4, 5.
Oh, that's what the. That's gross, right?
Yeah.
$85.
685?
Yeah.
All right, so does everyone have that? So in the one-time row, 1.2 million is gross, 506 is state. And in the base funding row, 1.6245 is gross, 685,000 is state. And I think Melanie explained it well. The one time is to shore them up for 2024.
Wait, I'm confused. I see 1.6 and in the notes I see 16.1. Are we doing 1.6 or 16?
I don't know what the
16,
16.1
that's
reference.
the whole number. That's for, this
Okay.
is just what they need.
Okay. I-
That's, right, that's
Okay.
everything.
1.6.
Right.
Okay.
Yeah.
Just making sure.
Exactly.
Right.
So we good with that? Thank you.
Any other questions? Okay.
Okay.
Well, I'm not sure it's for you. It seems like if this is mandated, we don't really have an option of yes or no, right? So this should be in Diva's budget and we're relieved of responsibility. And I say
But
that.
that's not how it was presented to us.
No, I get that. So here we are today.
Yep.
Yeah, because that's why I was wondering, could it be in Diva's budget? Isn't it their responsibility? It's their program, it's their subscribers, whatever the
Right,
right word might be.
But I would say that a lot is mandated in the DIVA budget that people who are not state employees do and may not be funded. And so therefore we have to make a policy decision. So it is our decision, not DIVA's.
But if the reason they didn't, is there a reason that they didn't put it in there?
Because they have a certain percentage, 3% was the governor's
Yeah, limit, whatever.
recommend. And so they made decisions they had to make.
So that was a decision that they made,
Yes,
not to include it,
it's a decision someone in the administration made not to include it, correct?
even though it's mandated.
Correct.
So I'm gonna see this question.
I mean, I get where you're coming from, but
There's something odd about that.
that's what that's why we're here. So that's,
But I mean,
this isn't the only time it's happened.
Mandated at some level. right?
Well, if it's
The federal
mandated,
level.
but it means that we
Medicaid.
can fund something else because they're not funding something that's mandated. That's what's confusing me.
I know it's confusing, but that's where we are. I mean, I don't know what else to say. That's like, yeah.
That's what they did.
I
They
mean,
had the authority, whatever, to do that.
the administration made the choice to not fund this in the budget. I will say the DEVA is working very closely with the folks to get to a rate that, and a change in how it's done so that we don't have to be here. So I want to be very clear that DEVA and you all are working, and I think you would agree with that, are working closely together to try and find a path forward to change because if you remember the way the rate is set up, it's per member per week. And there's less members, but a lot more rides.
rides.
Yeah.
And I
Right.
did ask that question directly of Diva, and they completely understand that we would have that confusion and they reflected exactly what Lori said and said that the new methodology that they're working on, I understand in close collaboration with this partner will be, as I reflected this in the notes, it'll be appropriately updated to reflect that utilization of the services that's going to be reflected so that their utilization keeps up with the funding every year, so they don't have to keep coming back.
Yeah, I'm not as much confused as frustrated. So I
Yeah,
just wanted to
we
say
all are.
that
Fair.
feels like the administration is sort of not relying on us to do their job, perhaps. Anyway, just saying. Okay.
No, I was gonna actually
Great.
the methodology change,
Yeah.
but it was all answered.
I mean, the VPJ doesn't want to come asking you for this money. The costs are what they are, and what's driving it are costs that are beyond the provider's control. It's the super users, it's the distances, it's all of the utilization and costs. They are what they are.
Thank you, Jamie.
Yep.
Okay,
Office of the Healthcare Advocate.
that's base funding. It's not one time. So we need to just change that.
All of it.
All of it is base funding.
What are we saying? I'm sorry, I missed that. For the Office of Healthcare. Oh, that?
Base.
It's base funding, not one-time funding.
They are asking for an increase, and this is just to keep up with inflation. 96,000 from the general fund. And by state. This is in addition to the governor's recommended 2.26 million and growth 953,000 for the general fund. So this would allow DEVA to bring FQHC rates into compliance with federal law and also align each of those FQHC's rates with its individual costs. Would be a 1.85 million from the general fund for a gross amount of 4.3 million. Next is something that was not, but usually is part of the governor's recommend, and that's funding for the household insurance survey, which is a key part of how we get much of our information about healthcare needs across the state. So we're basing this recommended investment on previous years. Nolan estimated it. Last year's was 387,000, so we're suggesting about 400,000 for this.
Can I ask a question about that before you go on?
Yeah.
Commissioner felt it wasn't necessary and sort of gave data that said like 3 people really tapped in asking about this data. Is that? I don't know. What do you think about that testimony?
So I will answer that. I think I've heard from people outside the building that they use this a lot, including JFO, Green Mountain Care Board, Healthcare Advocate. So there's quite a few people who use this.
So a bit of disconnect. I'm just saying
There's a disconnect, yes.
Thank you.
And Lori, one something you said when we were talking about it was that with the unwinding of Medicaid, this is very important with the hazards with data, especially.
And by not including that money in the budget, it would be an unfunded mandate because the.
Well, it doesn't require it. It just statute just requires that the commissioner make a recommendation every 3 years, I believe. It doesn't require that we do it every 3 years. I had to read that a couple times
So that's it. He did not make a recommendation either way.
Right.
Last.
until, right. So I think it was just missed, right? It was just
Yeah.
missed in the recommendation. and then came back and did not recommend it. Which makes sense because by that point, there was no room in the budget.
So this line bounces in and out every 3 years. Is that kind of what?
Yeah, every 3 years, they make a recommendation whether to do it or not.
Right.
And they usually do it every 3 years, and this year they did not recommend doing it.
This year we're in right now,
This is a thing that we do every 3 or
Right,
4
right.
years in general.
right, according to what it says here.
One
So,
time we did it 2 years in a row after ACA, look at before and after.
so we up to do it in 25?
That's what
The
we get.
government did not recommend it. This on the list of considerations
right,
for you to
but
decide whether to recommend it or not.
Determination is probably a good thing. Okay.
Mental health urgent care centers. This is not in the governor's recommend either, but this would fund the fourth quarter of FY 25. Committee would review, which committee is this? I'm trying to remember. Would review the results in 2025 session, determine if those programs should be fully funded in FY 26. So I think what this was is DMH testified and did indicate that the current program would have a gap so that there wouldn't be really a full spectrum of analysis for them to kind of make a recommendation going forward on the outcomes. So this would give them a full picture if we did fund just this last quarter. And that would be 200,000 from the general fund.
And so if we don't do this and the funding runs out in March, that does not give us time in the BAA to say, we think this program is working and it should be continued to be funded. So the ask would be to fund it through, as Daisy said, the fiscal year. So people sitting in the seats next year can determine whether it's working or not.
And then also it would have to shut down.
And then it would
Start
start,
up
right,
again.
exactly, right. And this does not fund it permanently. This just funds it through the end of the fiscal year of 25 so that there can be an analysis done on whether or not some or all of them are working. Art?
What are the mental health urgent care centers? Give me an example. Is it like PUC down there?
Yes.
It's those things that keep people out of
The
the
emergency room.
emergency room. That's what I want.
And there've been, I think, 6 that have been started up.
6. Okay.
Yeah, there's one in Lamoille County,
Yeah.
and some do children and adults.
All right.
Next is a request from Howard Center. There are 2 components to this request. First is the cultural liaison program. They're asking for, this is in the wrong column. This is all general fund. They're asking for 300,000 to fund the cultural liaison program. You'll remember, we put that request in the BAA for last year. And that's where they have staff who do outreach into the community, the immigrant community. They're multilingual. They reach a population that is otherwise, in my opinion, largely unreachable. I think they fill a tremendous gap in our system of
So
care.
this needs to be moved over to the other column.
Yeah, it's general fund. There's also 523,000 needed for their adult bed and residential program.
Is that matchable?
That's a good question, Lori.
Howard Center Adult Bed and Residential Program?
It depends what the costs are being used for, right? Like if that's capital.
Yeah, it depends on what it is for. You're only matchable if you're using it for Medicaid.
Yeah, I don't think so. I think it's Nick in the room. He was,
Do you want
yeah.
me to reach out?
Improvements and no, it cannot.
Yeah.
And this isn't the programs that Howard recently cut.
No, it's not. I was gonna mention that. They did recently cut some stuff. So these are other programs that are going to be cut if these are not funded.
Okay.
We did not hear someone in testimony on this, but we did receive a letter request that is posted somewhere. I'm trying to get it.
Yeah, and I know Nick was trying to be here. I think he just stepped out for a second, but he was trying to be here. So
So we can come back to that.
yeah, we'll come back to it.
Do you want me to resend it right now?
Yes, that'd be great if you have it. So I just put up, yeah, so I think what I want to be clear is as we're looking at these numbers, so moving like the 8, as you said, like the 300,000 should be moved over. Really, the whole thing should be moved over. So when the gross and the state match, that means it's all state. Right? So we have 823 in the gross column and we have 823 in the state column. That means it's all state dollars.
I think we were wondering if there's a match, but we never. got
Yeah,
that.
so we-
That was, we held it.
Right.
Yeah.
Okay.
So I put a little red note. I'm updating the spreadsheet as everyone's talking. And so I put a little note and I just sent the, letter.
Okay, great. Okay, EMS.
EMS, Melanie, do you wanna do EMS?
Oh,
I can do it.
Yeah, no, I can. Well, this was the, there's 2 lines. There's the EMS for the training, which we heard about this past week. And that is listed as $1 million. And then with the treatment, no transport reimbursement rate, the ask is there for 31,000 to get that shored up. So those were the 2 pieces that we've heard, and I don't know what else you want to talk.
So I will say on the training for the $1 million, that is not a VDH ask. That is from the advocates ask, just so we're clear on that.
Okay.
And then on the reimbursement, so if you remember last year, we took testimony that they weren't paying to, Medicaid was not paying if someone, EMS showed up at a house and they were treated but not transported. They did institute that in July of 23, but they did not institute it at 100% to Medicare. So this would be what would need in base funding to do that.
The million's gotta be general fund.
The $1 million would be general fund.
Yeah.
All right, so that needs to be in that column.
Yeah.
Well, it would be in both columns.
Yeah, it would be in both columns.
Right.
The VDH thing is just showing which budget it goes in.
Yeah.
Do you want me to put it back then?
Yeah, it should
Sorry.
stay in there, because when we share it with the program.
Yes, it should say in there.
Sorry, yep,
I just want to make clear for
that it wasn't their ask.
that it
yeah.
wasn't the rest. Okay.
Lori, a question on that, and Daisy and Melanie. That's listed, the training's listed as one time. Would that truly be one time? It seems like we'd be dealing with it all the time.
Yeah, so if you remember the testimony with Will Moran, so there's a EMS special fund that is about $150,000 a year that's put into that, and that's used for training. And but then what we found a couple of years ago was there was a big pot of money in there because it wasn't getting out the door. So we required EMS or BVH or whoever to get it out the door. And last year we put $1 million in one time to help get more people trained and into the profession. So that was one time. And so the request from the advocates is another round of one time. And House GovOps has the bill in their committee and is looking at doing a task force, and I need to talk to them about putting training in that task force.
Okay, so right now.
Figure out how to do it.
Yeah, we are. But the 150 is every year from the special fund.
Yes, and that's not in here. That happens.
Okay, for just to help. You remember we just had testimony, was that this week? Early this week?
Yeah.
On the healthcare needs and how this program is actually, I thought it was really interesting. They were impacting or reaching 85% of the population on IHIP. Approximately 4,000 people in Vermont. So just thinking about, okay, I'm not gonna advocate for the program.
Yeah,
sorry. This is an $835,000 ask.
Yeah, so it should be in both columns. Yeah. It is not matchable. It is one time. And I know that the UVM exchange, what are they called? UVM, is it
Exchange programs.
Exchange program.
Yeah.
And others are kind of just realizing that this money is going away and are looking to see what they can do to sustain it in the future. So I would say this would be one time in the hopes that they figure out a way to sustain it in the future if we do it. Okay?
Okay, and then, we have, potential bills. Yeah,
Well, yeah, we have the UVM
Yeah.
Cancer Center.
oh,
That would
sorry.
be general, right?
Yeah, that'd be all general fund.
Yeah.
And then, yeah, so, and I talked about this yesterday, I've talked to appropriations, if we have bills that have money, we're gonna notate it on our sheet that we're working on bills with money. So that they know that, but those aren't things we have to decide today.
And for the one-time base, I didn't know how to write it because it was like a 5-year program, so I know it sounds really like contradictory, one time for the next 5 years, but that's what they were.
Oh, yeah, so yes,
For which one?
For the cancers.
That's right.
Yeah, sorry.
Can I add, it's highly unlikely that we'll need an appropriation for the PBM bill.
right.
It's good
yes.
that we have been talking with appropriations just to warn them that
Yep. We're hoping that the fees will cover the bill.
Okay.
Okay, so Nick, can we ask you a couple of questions?
Sure.
On the request. So the cultural liaison program is what we helped fund at the end of BAA. Was it BAA or?
Correct.
Okay. But then what is the adult bed and residential program?
So Howard Center,
Say who you are for the record.
Nick Sherman, Leonine Public Affairs representing the Howard Center. The Howard Center has a variety of residential programs where they provide treatment in a residential setting. The request in front of you is on the room and board and housing side. There is a deficit in those programs. In FY24, it was 1.3 million. And the request is in FY25 for 523,000 to, it would be a one-time request to create a bridge to get through a year to try to figure out how to stabilize the housing, room and board part of the residential programs.
And is this residential? Tell me a little bit about the program. Who goes there? What's the length of stay? Do you have any of that stuff?
I would have to bring in
That's fine.
the Howard, I'm sorry, Madam
Nope,
Chair.
that's fine. And I know you sent something in writing, so you just sent that to everyone?
Yep.
Okay. And that's Claire to post it. Okay. I think we're good. Thank you. Appreciate it. Actually, I have one question. It's one-time funding, but do you know if it's matchable?
So they received their funding for room and board primarily through HUD, I believe.
Okay.
I don't, no, it's not Medicaid, no.
Okay. Thank you.
Thank you.
Okay. Claire, what time is Katie coming? At 11:30. Okay. Let's just make sure we're all in the same spot. We just went through these numbers. We've moved some things around. Does everyone feel pretty clear about kind of numbers in the right column? What's base funding? What's one-time funding? Okay. Which one?
721,
What's 721?
page 720.
Oh, I know. I'm not worried about that because we're not deciding that. And 350 is in the bill, but they said they're gonna need more money. Yeah, thank you.
Lori, what would it take for any of us to make these changes and then cop out a new one of these?
Yeah.
I made all the changes as we went, so I could, and if people rather it electronically, I
It
could.
just makes sense. to me.
Yeah, that's a good idea. So Claire, can you if we get this to you, can you get it to the print center to have them, whatever you did to do this magic?
Can we do the Alicia update too?
Yeah.
Yeah, so hold on, don't do it yet, Claire. Do we have an update?
Yeah, hang on, I'll.
Melanie, since we're updating this, can you remove the two lines that show the mobile crisis and the negative numbers? We don't need to decide on that. That's just moving
Yeah.
to global investments.
So 13 and 14.
Yeah. So we're all kind of, and then is everyone okay if we remove some on the first page? Under base funding, third from the bottom, it's the 862,000 for the, contract for my psychiatric care hospital, so we're in that contract. Is everyone okay if I remove that, because it's not,
It's on this contract.
Are we not gonna
yeah,
budget for
I mean, we have to, because it's in the contract.
it? Oh,
Yeah.
oh, okay.
So is everyone okay if Melanie removes that?
We're not removing that we do it, we're removing that we're prioritizing.
We're
it.
removing it from the
It
presentation.
has to be done, so we, yeah.
And could you just comment on the negative numbers, what you just said about that?
So DMH is moving the dollars to global commitment investments.
So that's the first 314.
Yeah, this stuff is gone.
That's the first, that's everything it's the two middle numbers that have negatives.
So
The
it's-
money's not going away, it's just moving.
Yeah,
So we took that,
so you'll take out,
those lines, they'll just be gone when you get your new sheets.
yeah, so there are three 314, so you're getting rid of three out of the five.
Yes,
Oh, 6, 7, 3 out of the
and
7.
a conflict council, because that's a legislative mandate. So we're getting rid of 4 of them.
Lori,
All right, yes.
to that thing, the contract we have, the remove, brings to mind, and this is a question that always bugs me. How many other things? I mean, we're looking at things we have a choice on, but underlying all that, there must be a whole bunch of stuff we must fund.
Yes,
Is that true?
yes.
I'd love to get a list of those things.
Well, I mean, that would take diving into their budget. I don't think there's an actual
Yeah, all right.
list.
It just seems, it'd be nice to have a reference of a total dollar, and I get what we're doing. I totally understand it and support it and what we need to do, but.
I think you need to be on appropriations.
No,
Keep them here.
no,
I mean, I want you here, but.
Get me an
But
appropriation.
I think that, and so what I would do is once they get through the budget, is sit with someone in appropriations and tell them that.
Even if we just put a number up, even if we just said, here's the amount of money that we're obligated to spend.
That's
It's not that easy.
Not that easy? Okay, never mind.
Sorry.
All right, never mind.
maybe. Question.
Yeah, it is.
Well, but these are fundamental things that, it seems like we should know, but.
So, if I may.
Yeah, please.
If you go into each of the agencies' presentations, they have that in there. So for instance, DEVA, they'll have, here's how much we have to, it's on the ups and downs, for instance, like, here's caseload increasing, here's what we have to do for payroll, here's what we have to do for increased rent. It's all in those documents. It's just a matter of like looking at those and saying, okay, here's what we have to do. And so what these agencies are doing is these things are like, what Lori's trying to do, Representative Houghton's trying to do is say, okay, here's some of the stuff that made it into the list, that's just base increases. And what you're really trying to weigh in on what the policy decisions that.
Right.
And the ups and downs, but everything else, there's increases throughout the budget that are just inflationary. If you want to know what those are, look into those presentations and they'll tell you, here's how much we increase for payroll. Here's how much we have more for rent.
But wouldn't that figure into what we're trying to do here? No?
You vote on that on the overall budget. See, what you're weighing here, what happens is if it's base, you've already voted on it in the past. Right? You've approved the program. So you're saying, okay, we approved this program. And so that just becomes budget. What they highlight is, hey, here's a new program. Or here's a program we're cutting. That's what these documents are supposed to be.
Right.
If you want to dig deeper into that stuff, the information is all there, but you have
Yeah.
carve it out. Say, well, we don't want to fund wage increases or rent. Then that's what, sort of Representative Houghton's like, that's what the appropriations committee is theoretically doing.
And so, we went into a time issue with some of this, right?
We should. I think.
But at the same time, we are trying to do some of that stuff. So like in the Medicaid expansion bill, we're asking them to look at all the investments they're making with global commitment dollars.
No.
Which that's gonna happen even if we don't pass the bill, but I'm just saying that's one example, like, Viva. You're funding a bunch of programs. And we need to understand if they're working. So that's part of digging deeper rather than just this. And so as
Okay.
committees, we should be doing that more often and
Yeah, yeah.
Representative Hughes, how about you and I sit down separately offline?
Yeah, okay.
And we'll talk further.
I just like to,
And I'll
yeah,
help
just,
you get some of those answers.
yeah, it'd even be good to know just the percentage of stuff we're dealing with here versus the overall.
We'll talk.
That'll be the-
Thanks, Laura.
Yeah,
Laura,
nope, thank you.
one quick question about for Howard Center. It sounds like the residential bed program, the 523,000 is one time.
Yes,
Is the cultural liaison program based
I would say it's one time.
one time, so I can put the whole
And
thing
if
in
you
one
can
time?
quickly separate those two lines.
Yep,
That'd be great.
Yep.
Okay, and we have new information. Right, Daisy?
Yeah, I'm just getting, language from Jen, Harvey.
Oh, yeah, she's coming this afternoon, Daisy, some language. She's tied up in the Senate this morning.
Yeah, she just sent it to me though.
Okay,
We were missing some language from, Jessa.
and I'm okay with that. I want to get to the numbers there.
And I think it's Jessa's,
Do we have numbers from Jessa or? from
yeah,
Viva?
that's, we don't.
Okay, that's fine.
The RBRBS 4.6. I don't think that's in there.
Page you mean?
Page, it's two. Or is that two?
Let's do this. We don't have the numbers, we're not gonna worry about that. Melanie's gonna update. Claire's gonna help us and get it printed. We're gonna take a break. I would say come back in 15 minutes, so 10:35.
Thank you.
Hopefully we'll have a new spreadsheet.